Ready? All right, we're going to call the meeting to order and we'll begin with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, good morning, everyone. So today's a little bit different model of work session than what we normally do. We are going to be meeting as the Board of County Health today. So welcome. It's October 23rd. This is Shawnee County Board of County Commissioners and Board of Health as well. I'm Aaron Mays. I represent District 3. On my left is Commissioner Rippon. He represents District 1. On my right, Commissioner Cook. He represents District 2. And then our County Councilor, Rich Eckert, at my far right. Good morning to all of you. We are going to start off with Teresa coming up, and she is going to first recognize our Public Health Champion Award winners.
All right, good morning, Commissioners. Our slide deck is a little bit different, so we will recognize them here, but I'm going to get through just a couple of other slides first. So okay. I'm Teresa Fisher, Director of the Health Department. So welcome to today's Board of Health meeting. We use this as an opportunity to not only showcase the work that we're doing within our own department there at the Health Department, but just as importantly, the work we're doing with our community partners and the work throughout the community. And today's agenda, you're going to see a variety of that work. So I wanted to also give a reminder, as Commissioner May said, we are meeting as the County Board of Health. That's required by Kansas Statute 65-201, in which the Board of County Commissioners also serves as our Board of Health. An overview of what you're going to hear today is you're going to hear from Brittany Rambo. Brittany serves as our maternal child health team leader. Alongside her will be presenting Trenton James. Trenton is the Adult Services Division Manager with Community Corrections, and the two of them are going to present on our Dad Zone and really a year in review. Dad Zone is a new initiative that was started that goes in conjunction with our Baby Basics classes. It's very innovative, and I think you'll be really excited to hear about the work that they've been doing. You will also get to meet Josh Van Drunen. Josh is our epidemiologist, and Josh is going to provide an overview and an introduction of what really epidemiology is, and he's also going to give you a review of what some of his current projects are that he's been working on in his short time with us. And we'll also hear from Sarah Carnes-Vincent, and Sarah serves as the Director of Live Well Shawnee County. And Sarah is going to give us our annual review of what Live Well Shawnee County has been up to and a look ahead into next year. And I can tell you they've been very busy. So there's lots of good information coming forward. But as Commissioner May said, I want to take a few minutes to recognize some special guests we have in attendance with us today. This year we held our annual community conversation on health back August 15th at the Topeka and Shawnee County Public Library. So we presented awards to both an individual and an organization who made outstanding contributions to our community by championing and leading equitable opportunities for health across the Topeka and Shawnee County community. We have multiple applicants in both the individual and organization areas. And so nominations were very stellar this year, but we did have two that came out on top, and those are with us today to celebrate. So first, we have Lissa Staley. Lissa Staley was awarded the 2025 Shawnee County Public Health Champion Individual Award. And I want to share just a few excerpts from Lissa's nomination form. I won't read it in its entirety that I shared at the conversation, but there's some pieces that I want to share. For over 20 years, Lissa has advanced public health by fostering cross-sector collaboration and creating inclusive opportunities for wellness. She has provided leadership in efforts to reduce health inequalities and fostered collaboration to improve the health of the population. Lissa has facilitated numerous planning sessions for community partners. She actually helped facilitate our annual community conversation that day. And through these activities, she's helped our community accomplish bigger goals than any one group could do on their own. In 2024, Lissa was recognized by the American Library Association as a mover and shaker. That's defined as one who demonstrates innovation, creativity, and a positive impact on their community. And we're so lucky that we get to have her here in our community. Lissa has a relentless commitment to equity and a collaborative spirit that expands what is possible in public health. With that, I'm going to invite Lissa to come up, and I think she's got just a few comments that she'd like to share.
Hello, I brought presents, they're voting buttons, and also, do you guys already have this book? No. Okay, it's from the Kansas Health Foundation. It's their new initiative, and like you all should have it, so I got you copies.
Thank you.
Thank you.
Other people are going to bring you copies, but now you have one. Say, oh, I've got that.
Great.
I, like in 2015, was here and Commissioner Cook said, oh, that community health improvement plan, like plans are great, but we have to actually do the work. And I wrote it down and I taped it at my cubicle. I look at it all the time. When I accepted this award, I had a few days notice, so I wrote a love poem about public health. I'm going to read it to you and I'll probably cry. This is what I read at the day too. It's what I've learned. Public health people taught me that leadership is an activity, not a position. Public health people believe that science matters. Public health people love pithy slogans. Stay alive, don't text and drive. Be wise, immunize. Public health people care about people they've never even met. Public health people search upstream to discover interventions to prevent future suffering. Public health people are always working on the next CHNA or CHIP or CDRR grant from KDHE with BRFIS data and support from DECA and KLC and KHF and KHI. Public health people know what all those acronyms mean. Public health people want to make the healthy choice the easy choice. 5 a day for better health. Safety is no accident. Public health people go to bed at night worried about emerging challenges that the rest of us don't even realize exist yet. Economic policies, social norms, and political systems shape the conditions in which people are born, grow, live, work, and age. Public health people want health in all policies. Public health people recommend you and your new romantic partner both go get tested because the Shawnee County sexually transmitted infection rate more than doubled between 2002 and 2022 and has continued to increase. We, the people, established the Constitution of the United States in order to promote the general welfare. Public health people need those government dollars to fund that work. Public health people use words like disinvestment and inequity instead of racism to make it easier to talk about the differences and challenges they observe in their outcome data. Public health people have charts and graphs to back them up. Public health people ask questions like, what would it take for this problem to never happen again? The metric of success for public health people seems to be collective happiness. More people living longer, healthier, higher quality lives. That's pretty cool. Public health people simultaneously care about every single person in our community all at the same time, and they call it population health, but I think that is what love looks like in action. When we support public health people, we are all the champions. That's all, thank you.
Thank you, Lissa. All right, we awarded our organization award for our 2025 Public Health Champion to Scent. And again, I want to share a few excerpts from their nominations. Scent is not just another nonprofit. It is a trusted neighbor and a tireless advocate for the people of Southeast Topeka. Scent is redefining what a health organization can be, one that nurtures the physical, emotional, and social health of Shawnee County through equity, compassion, and community-based care. What sets Scent apart is a relational and resident-led approach. The real impact of Scent is lives being changed, the parents receiving mental health support, the families finding stable housing, the children growing up in a neighborhood with hope. Scent is not just building houses or running programs. They are helping to build a stronger, healthier, and more resilient High Crest. Scent is redefining what it means to care for a community. And today representing Scent is Jill Rice.
I wanted to take a moment and say thank you for awarding us this opportunity. We have really been focused over the last couple of years of building a one-stop shop resource center that's really focused on creating healthy communities. We realized, we were just talking this week, and kind of listing out all of the things that you can get done in one place. You can see express care, holistic health care. You can get a mental health appointment, a substance use disorder appointment. We partnered with other organizations to bring in chiropractic care and massage therapy. We're having conversations about adding physical therapy opportunities to that, trauma-informed occupational therapy. All of that can happen in one location in our building in Southeast Topeka, which is remarkable when I think about the hurdles that our community has had in accessing care. We know it's available in Topeka, but actually being able to access that. And so our goal has really been, how do we open those doors? How do we make this more accessible to people and make it affordable? So thank you. Appreciate your time today.
Thank you.
We're going to take just a brief pause and do a photo opportunity with our award recipients and the commissioners. Thank you again for being in attendance, and how lucky is our community to have such champions in the work that they do. With that, we will move forward with the rest of our agenda, and up first is Brittany and Trenton.
I also brought, oh wait, one more. So what he's handing y'all is the actual presentation that we present for our dad zone, so y'all can look through it, because we don't have the time to go through the whole thing.
Sure.
Also, y'all aren't expecting dads, so you're not quite our target audience. So you have the presentation and then the book that we're going to reference later on that we made for our dads. So this is Dad Zone, and we're going to go over like a brief, quick history so you'll have the context for what it is, what we do in it, and what's the point. And this is Mr. Trenton James. He's our current Dad Zone instructor, because I'm not a dad. So this class goes in conjunction with our Baby Basics program, which is a prenatal education program that we get through KDHE. It's statewide. The core curriculum is statewide, but it can be tailored for each county based on what their needs are, right? Based on who's doing it and what they need. So our Baby Basics program was actually started by Teresa and Missy back in 2017. And it is a 6-week program. We meet once a week for 2 hours and cover everything from, hey, you're pregnant, now what? What do you expect? What does this look like? To the postpartum period for what are you going to be going through? So it's very comprehensive, and it's for moms and dads. We encourage our participants to bring their support person, whether it's father of the baby, whether it's your partner, is it your mom, your best friend, whatever, right? So it's tailored for both parents, but the nature of pregnancy is that you mainly focus on mom because we're the ones carrying the baby, right? We're the ones going through everything. So how do we bring in our dads? How do we get our dads involved in this when it's hard, right? And up until this point, media and societal pressure is dads need to be a provider. You need to worry about what you're putting on the table and what you're bringing home, and she does the rest. But that's really not what we know. We see the science and the evidence that supports the positive outcomes for not just baby, but also dad, when dad gets involved in that prenatal period. So that's where we're starting at. Missy and I went to a conference about the Becoming a Mom curriculum statewide a few years ago, and there was a man there from Geary County who started a dad's program because they have the base out there, right? And so there was a huge pool of dads, younger dads, who weren't involved. So how do you get them involved? you have to tell them. We have to tell them what to do. And so Missy and I heard about this program and decided that we wanted to bring it here. And so we worked with Mr. Alex Tyson, who is the guy who created it out there. So our program is done in conjunction with Baby Basics, but it's not part of Baby Basics. This is our own thing that we created ourselves. Sorry, y'all. So the whole goal of it is that it's for dads taught by a dad. So it's not me, a nurse or a mom telling you like, this is what you need to be doing. It's taught by a dad who has walked that road, who knows what it looks like, who has done it and knows that. So that's where we're at. It started in 2023. We started it a little less than halfway through the year. At that time, we had 19 dads. The next year, we had a full run of it, so we had 5 sessions of Dad Zone, and we had 36 dads. And up until this date, we've had 35 dads participate, but we haven't yet had our last session of the year, so every year we've grown exponentially, and it's very cool. So what is it? Like, what are we doing in class? The information is presented across the board. We're not pandering, we're not condescending to our dads. None of that. We're meeting them where they're at and saying, hey, we're telling you to get involved, but what does that look like? You know, what does that look like for you? What does that look like for your family? We talk about the statistics because I don't just want to tell you, hey, do this. I'm going to give you the evidence and supporting why I'm telling you to do this so you know that I'm not just pulling it out of my hat. We talk about what your role is as a dad, because again, you're not the carrier, right? You're not growing the baby, all of this. So what do you do to be involved? How does your involvement impact baby? You're the watcher. We need you to watch mom and be that early alert for any signs or symptoms that we're seeing of prediabetes, gestational hypertension, infection, anything like that. But what does that look like? Because at those prenatal appointments, maybe you're not understanding and you don't feel comfortable asking. So why don't we talk about that? Let's tell you what you're looking for. What are those signs and symptoms and what does it mean? When is it an emergency? When is it fine? What does that look like? Because this is your role. You're the protector, you're the watcher, right? We talk about how do you, in that immediate postpartum period right after baby has come, what do you do? Do you just sit on the couch and watch everybody hug mom? No, you know, we need you to be involved even then. One of the big things that we talk about is doing skin to skin. It is pretty much policy and procedure across the board for as soon as baby is born, they put baby on mom's bare chest to do skin to skin because we've seen the science and the evidence that supports the outcomes for mom and baby after doing that. But it also works when dad does skin to skin. When dad does skin to skin, it helps with paternal bonding. It helps babe regulate their body temperature. It helps them regulate their glucose. It helps them regulate all of these body systems when it's dad to baby skin to skin. But it also helps dad, and that's how you're involved. You're a part of this. You're important. You need to be involved from the very beginning. And that's what we're trying to express. We also talk about the practicalities of how to care for a baby in a dad-centered way, right? And so we have videos and we bring in humor with it because it's a funny time, right? And so we talk about how do you do these things? What does this look like for you? We talk about how to support during breastfeeding, what your role is, because that can also be an isolating time frame for dads because again, you're not breastfeeding, right? So what do? Do you just sit off to the side? No. We talk about what early hunger signs look like. We talk about early, mid, and late hunger signs so that you can be the watcher and be like, hey, babe's doing these signs. Let's get you some water. Let's get you some snacks. Let's get you set up so that you can breastfeed. That's how you're involved. Like, you're not the one breastfeeding, but it's really important that you're still here and that you're still participating. And then one of the big things that I'm passionate about is postpartum depression. We know that 1 in 7 moms suffer from postpartum depression in America, but the science is now showing us that 1 in 10 dads suffer from postpartum depression as well. But again, societal and media pressures tell us that dads are supposed to, like, you don't talk about your feelings, you suck it up, bottle it up, put it in a box and hide it away, right? But that's not healthy. And we can see the problems that arise from that later on down the road. So we talk about that, we educate, we provide that information, and we destigmatize it. Like, it's okay. It's a huge change for moms, and we know that, and we support that. But we're also recognizing now that it is a huge change for dads too, and it's a lot, and we need to recognize and support them as well. And then, so looking towards the future, this year we also started our prenatal education program in Spanish, Conceptos Básicos de Bebé. Next year, one of our big goals is to expand our dad zone into our Spanish language classes with Zona de Papa. That is going to be a big undertaking because we have to translate everything that we've created into Spanish, because all of this was created at our health department by us. So we have to get all of that translated. We have to find a dad. But that's one of our big goals for next year. We also already partner with KCSL and Nathan Voss, who does their dad community support programs. He comes to some of our classes to do that continuing outreach in the community, right? Because our class is a one-time thing. Where do you find that support going forward? You talk to Nathan, and so we're here to give you the immediate resources, but also to help you find them in the community going forward, because maybe you don't need them today or tomorrow, but 3 months down the road, where do you turn when you need help, right? So we also would like to expand that partnership and work with other community partners to hold events outside of Dad Zone. So one of the ones that we've looked at in other counties is like a pizza and pigtail situation, where we have an event and dads and daughters come, we have pizza, we play movies, you wear pajamas, and we teach you how to do some hairstyles, some like basic level hairstyles, right? Because again, we want you to be a part of this, but we need to help, we want to help you do that so you know what to do, you know where to look, you have a place to get those resources and those questions answered. There's also some fishing events and things like that. So that's what our goal is for the program, to grow it in this next year. And then Mr. Trenton James will give some feedback because, again, he's the instructor.
Trenton James, community, volunteer would be the phrase for it. I could talk forever, so I wrote a quick statement that I would like to read to you guys, but I do want to say that it's been an extreme honor and privilege to be part of such an important program that offers assistance to guys in our community who could actually benefit from it. So before every session, I tell the guys that despite the fact that I am just a facilitator, I do not consider myself to be the subject matter expert, because being a good dad does not come with blueprints. It comes from experiences. Experiences like bringing a baby home for the first time and being afraid that you will somehow break it, or from putting a diaper on too tight and learning that it can be just as bad as not putting one on at all, or that you can carry a note good enough to soothe a crying baby. The Bible speaks about individuals possessing worldly goods. It goes on to say that if you have this world's goods and see your brother in need and shut up your bowels of compassion, how dwelleth the love of God in you? I'm not a millionaire, but I do possess a million valuable good packages as lessons from being a dad. Lessons that I'm willing to share with a brother or a sister in this community who is in need. And I would like to say that this experience has been every bit of that. I have guys that come in who are first-time fathers who are 18, 19 years old. You can see that they're afraid, that they're nervous. They don't understand what's going on, but they know a baby's going to be showing up in their home at some point in the future, and they don't have anyone to speak with or talk with. And I think sometimes when they come in, they see me dressed professionally and they assume it's going to be a very rigid process and I'm going to talk, from books and things of that nature. But when they come in, I tell them this is just going to be a session of guys just chopping it up, having conversation and talking about life and what it means to be a father. And I've seen guys go from, there's pictures up there, guys slouching down in their chairs, to sitting upright, watching the videos, asking questions, and engaging with other people that are part of the group. And I know that's what this is all about. So I can't say enough good things about how this program is working. I hate the fact that I wasn't part of it when it first began. When they reached out to me, or actually when I reached out to them, Brittany was quick to tell me, we can't pay you for this service. And I was not interested in the pay. Like for me, I feel like my worldly good is being a dad. And I've been a father for 25 years of my life. Been the best experiences that I've ever had. And I just love sharing that experience with other people, especially the dads in this community who have that need. So if you guys have any questions, I can be specific or in general, but I'm willing to answer.
Any questions?
Just contact if a person is wanting to get involved or get into the dad zone, how do they go about doing that? Because I was just Googling, I Googled dad zone, and I'm hitting kind of some roadblocks, and so how do they go about getting enrolled in, involved in, active with the dad zone?
That's a great question. So currently, Dad Zone isn't offered as a standalone program. It is in conjunction with our Baby Basics. So we have, if you Google Baby Basics, it will bring you to our website and give you the contact information to log into that. That is something that we have talked about, but the way you eat an elephant is one bite at a time, and we're just not to the point where, oh, that's better. Oh, so sorry. So we are not to the point where we can create a standalone fathers program. That is a goal, but also given, I'm not sure how to phrase this. It's a big undertaking, and it will take some time and planning to figure out what that looks like, how we're going to fund it, what is the point, what is the curriculum, because again, Baby Basics was given to us. Like, it's a blueprint for what we can follow. There is not one for dads. And so while I would love to do that, and I want to, it's something that will take some time. We are a small team, so.
Well, like I said, that was just trying to make sure that if we have people or resources, how to get them involved. Even Baby Basics, just it by itself is a great program, and so every program starts somewhere.
Exactly. And it's really exciting to have that future growth on the horizon and to see where we would like this to be. I mean, honestly, I would love for Baby Basics. There are so many people in the community who don't know about Baby Basics. It's a normalization situation, right? And I would love for Baby Basics to be normalized and the whole community participates. You find out you're pregnant, let's go get some education and figure out what this looks like. And then from there, get involved with our Dad Zone program, and then from there, grow the program to be its own standalone thing.
That's right.
Hopefully in a couple of years, I'll be back and I can tell you, hey, we did it, and this is what it looks like now.
Sounds great. Thank you.
You're welcome. Any other questions, comments, concerns, complaints?
I don't know about any questions, or complaints for that matter, but I took a class similar to this when I was becoming a new dad 18 years ago. It was offered through St. Francis Hospital, I believe, at the time, but I think and then I actually came back and took my baby so that the guys could practice changing diapers on him. I feel like I got a lot out of the program back then. I'm sure it's developed and become even better. It was a little different, but still very valuable. So thanks for doing it.
That's a great dad move. Fantastic.
Yeah.
Great job.
All right.
All right. Have a great day, y'all.
Yeah, thank you.
I could have probably used the hairstyling tips. I had one. It was a ponytail. That was it. There we go. Pull it back, rubber band. It was good.
I've got big shoes to fill with such a great presentation. Hello, Commissioners. My name is Josh Van Drunen, and Teresa introduced me earlier. I am the new Shawnee County epidemiologist, and for today, I'm gonna introduce myself a little bit more, and then we're gonna kind of have a brief overview of what epidemiology is and kind of what my role is in the health department. So a little bit about me. I just said my name, so I won't reread it. But my education, I got a Bachelor's of Science in Public Health and a Master's of Public Health and Tropical Medicine from Tulane University, which is in the lovely state of Louisiana, in the city of New Orleans. But I'm originally from Florida, so we're all over the map. And then I chose to work here in Shawnee County, Kansas, because as I met the team and I went through the interview process, I really liked the ideals and the background, and I wanted to make a difference. So with that, we're going to move on to what is epidemiology. The textbook definition of it is the study of the distribution and determinants of disease in populations. When we talk about distribution, we talk about the where and the when. This is the geography, this is the temporality, so the timing. This can be demographics. And then as we talk about determinants, we're really looking at the why. And so below, I put it in layman's terms to further simplify it and just say that epidemiology aims to learn where disease occurs and why it occurs there. So in the context of my work, what diseases are most prevalent in Shawnee County and are the biggest health burden for our residents in Shawnee County, and why? And so what does an epidemiologist do? We investigate a variety of health conditions and disease, including infectious disease, chronic disease, mental health, and environmental related diseases. This is not an exhaustive list. For any health condition or disease that you can think of, there is an epidemiologist who studies it. And the process through which we investigate these health conditions and these diseases is by gathering data in Shawnee County, local data, analyzing kind of results and where it is, and identifying trends and kind of red flags of like, hey, this looks like it's a concern. This is kind of out of the normal given the national context. And then that's a great segue. We then kind of understand the context. What kind of social, political, and developmental factors are at play in Shawnee County that are contributing to this problem or making it worse? Or on the flip side, what policies are making us do really well? Because my job isn't just looking at what's going wrong. My job is also to understand what we're doing well and why we're doing it well, so we can then translate it and bring it over to improving health outcomes for the things that we really struggle with. And so the last part of that process is kind of creating and recommending interventions. And so to me, an intervention is an action X to improve or move outcome Y. And so that can be positive or negative. So that means either lowering obesity rates, increasing physical activity. But really at this part of the process, I'm looking at what are the biggest factors that impact these diseases and conditions, and what do we as a health department, but also as a community and as a coalition and as our nonprofits that have presented and talked today, have the biggest ability to change and impact. And so with this, I'm going to kind of talk about how does epidemiology show up in communities. So something that we see is that mental health concerns occur at a higher frequency in current and formerly incarcerated populations. So in my work, I would look at this statement and I would ask, well, how long does it take for an incarcerated individual to access mental health services? And if it's really long, how much longer? Can we expand support programs? And if we do we see less struggles with mental health and better access? And then 3, how do we create strong reentry programs, and what is the impact on reducing mental health concerns for current and formerly incarcerated populations? And is there a potential to reduce crime rates and other kind of societal factors and kind of just improve the community health and well-being? So my next example is about heat-related illnesses, and that's completely different from mental health, but it is something that is of concern as Shawnee County gets hotter and hotter every year. And so what I'm really asking is, how easily accessible are water fountains in our Shawnee County parks? And how many water fountains are there per person? When people go, are they able to easily access water to maintain hydration? Because we know that hydration is one of the leading prevention strategies for heat-related illnesses. But along with that, kind of what is the shade density? How many trees do we have? Can people find places to sit under the shade when they're struggling with heat-related illnesses in our parks? And then kind of as a third one, what is the average distance between our parks and the nearest ER? And how quickly can someone suffering from severe heat-related illness access treatment? And so I kind of hope with some of these questions, we kind of realize that my job doesn't just look at health factors or like just morbidity or disability and mortality and death. I'm really looking at all policies and kind of how they impact the health of Shawnee County residents, and how the policies that we pass for public works and parks and recreation kind of come together to form a really strong safety net to improve the health of Shawnee County residents. And so my last kind of example for how epidemiology shows up in communities is that Shawnee County has a higher motor vehicle death rate than the state of Kansas and the United States. And so I would ask, are motor vehicle deaths more common in our young adults and teenagers, middle-aged populations, or perhaps elderly drivers who are starting to struggle with getting around the roads? What is the density of potholes on county or city roads? And how does increased potholes impact these motor vehicle death rates? And then as well as, can increasing the frequency with which roads are salted in winter decrease motor vehicle death rates, and making sure that we are timely and apt? So kind of like I said previously, and what I'd like to reiterate is, as I look at these health problems or these issues and the status of health in our community, I am really looking at the whole context and the whole picture rather than just health-related or hospital-related metrics. So kind of moving on, how does epidemiology show up within the health department? So how do I do my job inside? And so the bulk of our work my work falls within the 3 out of 10 of the essential public health services. These public health services are kind of identified by the American Public Health Association, and they're backed up by the Centers for Disease Control. And they're kind of identified as 10 things that they really want all public health agencies to support and develop. And so for me, mine come into play when we assess and monitor population health, which is the first red one. I know the picture's kind of tiny, I apologize. It's that first red one right there. And then the one immediately following it, investigating, diagnosing, and addressing health hazards in their root causes. And then kind of the third piece of my work falls within the domain of improving and innovating through evaluation, research, and quality improvement. Kind of looking at, are our interventions, working? How can we make sure that our initiatives in Shawnee County are best aligned with current research and best recommended practices from various health-related agencies across the United States, and other things like that. And so my current projects, as I kind of talk about this, I'll start with the first one, which is reportable disease investigation. I do a lot of the disease investigation for our hepatitis C cases to support our nurses in our clinical services department, because by helping them, they get to see more patients and deliver a lot more of those critical public health services offered at our 10th Street clinic, like STI treatment and surveillance, as well as tuberculosis programs and vaccines. The second part is the community health needs assessment and the community health improvement plan. As far as that is concerned, my role is to kind of take the data that I have and the assessments that I make about the health of Shawnee County, and also provide more data to our Live Well Shawnee Coalition to give them more context as they build out their activities, and they take our data, or my data and my assessments, and they translate it into evidence-backed public health programs similar to Dad Zone or Baby Basics. Improving prenatal education outcomes, I have the honor of working with Brittany. Like she said, Baby Basics is developed by the state, and it is, but you can tailor it to each county. And right now we are working on collecting feedback to how we can really tailor prenatal education to Shawnee County residents and keep in mind some of the barriers and struggles and challenges that they face along their prenatal and eventually postpartum health journey. We're working on analyzing indicators of parental stress and how after a baby is born, how that impacts parents, and are parents more stressed out, and do we understand why? And that is done with the amazing nurse-family partnership programs in the Shawnee County Health Department, where nurses go and visit first-time mothers, but also other mothers who have children. Access to care, we're kind of looking at improving referral processes, so understanding what we most frequently get calls or asked about at our community health events, but also at the health department, and how well we can direct people to those services, as well as building stronger partnerships with the community partners who deliver those services to make sure that Shawnee County residents have the best ability to access care when and where, as well as how they need it. And then the last kind of key part of my job is public health informatics support. Public health informatics is a fancy term for data. So I just provide, to the best of my ability, data to support initiatives within the health department, but also with our community partners to kind of expand public health in the services to really make sure that we prevent as much disease as we can, as well as improve the health and the well-being of all Shawnee County residents. So with that, that's kind of the end of my talking piece. But if you have any questions, I'd be glad to answer them.
Any questions?
Yeah.
No. Commissioner Rippon?
In studying all this, do you see any areas that are, you say are out of the norm as far as, maybe unaccountable deaths, or do we have more people that suffer from, I don't know, depression, or do we have more suicides than normal in state, or do you see areas that are of concern, I guess is what I'm saying?
Yes, so Shawnee County does have a higher suicide rate than the state of Kansas. That data is published by KDHE on their BRFIS, or Behavioral Risk Factor Survey. I can't remember what the last S stands for, but that survey on their website. They go as far as in detail to say that a lot of our suicides are related to firearms and firearm violence. We see that Shawnee County actually has more mental health care providers per person than Kansas and the United States. However, despite the availability of these healthcare providers, Shawnee County residents are not able to access this care, and the care has been reported to not be the best quality. And that is one of the barriers that we are running into of it's available, but there's roadblocks to getting to treatment. And then once they're in treatment, it's still not going so well. We're seeing, I can say I'm seeing a rise in depression rates for our older adults, which is especially important as we look to see an increase of our 65 plus population in Shawnee County. And our median age will slowly uptick. We are currently have a median age of 40. That means 50% of Shawnee County residents are below 40 and 50% are above. Those are some kind of statistics, but a lot of our mental health struggles are also related to substance use, as you guys have had frequent discussions about and have looked at supporting and developing initiatives. Does that answer your question?
Yes.
I thought we were going to talk about pandemics. So, no, I appreciate everything that you have brought forward today. And in all reality, though, the work that your position does really became highlighted during the COVID pandemic. And so being able to explain what is it that you do when there's not a pandemic, and hopefully we never see another pandemic in our lifetimes. But your work is important to be able to identify, this is the problem, let's work upstream to see what are the causes so that the public officials, such as ourselves, are able to allocate resources to address those. And I'm just going to take the example you gave of heat and looking at water fountains in the parks. If you were to come to my office and say, I want to put more water fountains in parks, I'm probably going to question, even if we expend the money for water fountains in the parks, are people going to use them? Is there a negative connotation with water fountains now that we see them as being unhealthy? We've been conditioned now that all water must be consumed from plastic containers. And so you can have public officials that have good intentions of placing available resources, but because of a negative public perception, they might not be used. Baby basics. And again, for my own just encounters with the public, sometimes the public health department is viewed as that's something for people that don't have financial resources. That's not for me. I'm of a middle class. I don't want to put myself in that program because that's for people that don't have resources. And so there might be a negative connotation there, even though it's a great program that's available to everybody. How do you overcome that barrier? And so, again, that's maybe not your job to identify, how to overcome the barrier, but to identify this is the problem. How do we go upstream? How do we identify it so that you as the financial deciders are able to maybe allocate resources appropriately? So, thank you.
Yes, thank you for that. I will say we are at an exciting time, and a lot of the statistics that I've shared are addressed with our priority areas in our CHIP. And so while I may not have a big role in inducing behavioral change and structural change, I do think that it's important that I provide the best quality data that I can in order for our partners like LiveWell and Scent and the public library to then build robust programs that will inspire some of that change so we can bring people around and make them really associate the health department with more than just serving underserved communities, but protecting the health of all of Shawnee County. Yes.
All right.
Thank you.
Thank you very much.
Thank you.
Good morning, Commissioners.
Morning.
I think this is my first official annual update since our new agreement was signed. I don't know when, time is fuzzy to me, but nonetheless, I'm excited to be here, and thank you for your time this morning. I'm Sarah Kearns-Vincent. I'm the LiveWell Shawnee County Director, formerly Heartland Healthy Neighborhoods. And I want to just go over what 2025 has looked like so far. Before I go any further, that little girl on the bike is my daughter, and she wanted me to tell you all good morning. So good morning from Kalani. I'll talk about what she's doing here in a little bit when I talk about some impact team projects. But it's been a really busy year for LiveWell. We have a lot of growing partnerships, and then in that also some new investments in the community, and I just want to go over a snapshot of what those investments in the community look like, and you're welcome to ask questions as we go or at the end, whatever works best. So besides the generous investment from the county, we have two major grant initiatives that further our work and further our mission. The first one is the Pathways to a Healthy Kansas from Blue Cross Blue Shield. If you remember, we have, I think in the past we've had two agreements with the county in previous Pathways work, and I know Dr. Linewetter is working on some work with you, Bill, or excuse me, Commissioner Rippon. I just looked at your name tag and said it. But we're hoping to do more work in the future with Pathways and the county, and then beyond that, in the community, it's a $100,000 investment in Shawnee County over 2 years. So a lot of exciting things happening there. All the Pathways work is focused around behavioral health, healthy eating, active living, and commercial tobacco cessation. And then our second grant initiative that we're working on is Food Secure Communities from Kansas Food Action Network, and that focuses primarily on food insecurity and the root causes of it. These two pictures, the blue background is at our Pathways to a Healthy Kansas Spring Learning Session, which is always really great, robust training from Blue Cross. And then I was actually able to go to DC for the FRAC, Food Research and Action Center, annual convening in DC in May, and that was with Food Secure Communities. So as a reminder, we have 7 impact teams. In the past, we've called these work groups, but we felt the name impact team was a much better fit considering the work that these folks do. They focus on the areas of the CHIP that were informed by the community health needs assessment. And so, in other words, they focus on the greatest health needs in Shawnee County as determined by the community. So you'll see those listed there. And then I want to talk about, I won't hit every impact team, but I want to talk a little bit about work that these folks are doing or that they have done in the last year. So our pantry convening group, it's not an official name, we're working on it. But I think it was in March, we got 6 of the higher capacity pantries in Shawnee County, food pantries, together in one room, which we realized hadn't happened in over 20 years. And you'd think that they would need to talk to each other, right? Turns out they're really busy, and that's hard to make happen. So the Healthy Food Access Impact Team, and in partnership with United Way, and I have been organizing that group and working on trying to do some innovative programs within their cohort so that we can address hunger in a more sustainable, more effective way. And that has been really rich conversation so far. I've learned a lot from pantries, and I think, you know, if you're watching the news, food security is it's only going to increase, and so this group getting together is more important than ever. And I think some really innovative programs are going to come out of it. I'm excited for it. Next, something from our mental health impact team that I'm really excited about is the Therapist Finder tool. I think one of the more popular Therapist Finder tools comes from Psychology Today. Of course, it's a nationwide tool. Therapists have to pay to be a part of it. What we found in looking at a model from Manhattan is that a local resource is really helpful to both therapists and those who are seeking therapy. So with Create Uplift, who we contract our web design and social media content through, they've helped us to create this Shawnee County Therapist Finder tool, which is still in the very early stages, but I think our feedback that we're hearing from therapists that have looked at it is really good. And I hope to, in the future, connect it with some new community resource navigators that are starting in the county, in the area, and then also with some transportation services. That was, I think, Director Cole's back there. Yeah, Director Cole was part of that work on mental health, on the mental health impact team, and I am really excited for this initiative as well. So for a project that Healthy Babies does. We've heard a lot about preparing parents for parenthood today, and I think that's really exciting. The Kansas Infant Mortality and Stillbirth report points out that looking at infant mortality is a really important indicator for what a community's health is. And we know that that's a need, an area for focus in Shawnee County. And so this very successful community baby shower, I think, is very important to the community, is a huge part of or a huge partner in that is the health department, but then other folks on the coalition that are focused on helping parents and newborns is a really important venture for our coalition. And then going back to the picture on the bike, we've done 2 of these now. They're called traffic gardens. They were funded through a grant that the coalition applied for from Topeka Community Foundation. And they are a scaled down version of a streetscape or city street grid on a blacktop where kids can safely learn pedestrian safety, become, in the Midwest, most kids are going to be drivers someday. So it also, we think, increases pedestrian awareness for future drivers. It's a great place to interact with your kids outside. And we've done these 2 installations in areas that are lacking in outdoor space where that's safe. We have one at Ross Elementary, that's the ribbon cutting picture, and then one at the Stout Center, the CRC Stout Center. And they've just been a lot of fun. They're fun for kids, and it's a fun project for the coalition as well. I think the idea came out of something Andy Fry saw from Philadelphia. I'm not sure, but we've had a lot of fun learning how to put these in and hope to get more out there and improve them as we go. So those are just a few examples from our coalition's work this past year. Moving forward, something that is very much a part of my day-to-day right now is writing the community health improvement plan that will come out in December. That'll be the 2026-2028 plan. The picture is a group of us at Circle working on it. We're putting a lot of work into it because we want it to be really good. Josh mentioned his skills that he brings to the table, and they've been really valuable in writing this resource that we hope anyone in the community can pick up and find their place in, can better engage with what the need is in Shawnee County, and then go out and do. Even if it's something small, we hope that this plan can encourage folks to do something that will better this community. And then it's also, of course, the framework for how we as a coalition move forward in the next few years in that CHIP-CHA cycle. And the priority areas that will be laid out in it are behavioral health, food access, neighborhood safety, and housing, which this is the first time this will be prioritized in a CHIP. And then health equity, which encompasses maternal health, obesity, and STIs. These are all informed by the community health needs assessment that we did last year. And I think we've got a lot of really good minds on this. It's the most collaborative CHIP that we've written so far. And I'm excited to present it to you in December. Which leads me to that presentation is December 12th at our annual Action Summit. We have this every year, but this year will be particularly exciting because we'll present the Community Health Improvement Plan. We'll walk through it. We'll talk a little bit about progress that was made on the current CHIP and where we need to go in terms of what we didn't have as much success on that current CHIP. Josh will do a lot of help a lot with that. And we'll also set the tone for the work groups or the impact teams and the community members that attend as we prepare to really execute this next community health improvement plan and move the work forward. I hope that you all will attend. I'll make sure an email gets sent to you so that you can register, but I think it'll be worth your time and a great way to see what these work groups, or excuse me, I keep saying that, impact teams are doing in their coalition work. Any questions?
Any questions?
Thank you.
No? Thank you very much.
Thank you so much.
Teresa, I'm being told that we need to stand. So we do this at 1 hour of every meeting. We stand for a few minutes.
We love that resolution, and we embody it in every health department meeting. So my team, that's one of the first things they learn. So this does conclude the portion for us today for the Board of Health meeting. I hope for you, but I also hope for the public, it provides just a perspective of the vast amount of work that the health department does. We are far-reaching beyond the brick and mortar buildings that we have. You've heard from community partners today. You've heard from multiple ways that you can get involved. And so I just encourage everyone to keep their mind open and really hopefully understand that public health is expansive and that everybody plays a role here in our community's health. So thank you for today.
Thank you.
Thank you. Okay, so our next item is the Mayor's Task Force Against Domestic Violence Annual Report. All right, let's go ahead and sit back down.
Those are the slides that he wants to. We can move it this way or this way.
Thank you, Commissioner Chair Mays, County Commissioners Cook and Rapon, and Mr. Eckert for the opportunity to speak with you all today on behalf of the Mayor's Task Force Against Domestic Violence. It is especially fitting to be presenting this information to you in October, as October is Domestic Violence Awareness Month. My name is Becca Spielman, and I am the Program Director for YWCA Northeast Kansas's Center for Safety and Empowerment. With me is Christina Chavez, our Assistant Program Director, and we are the facilitators of the Mayor's Task Force Against Domestic Violence, whose mission is to hold domestic violence offenders accountable and ensure victim safety through collaboration, education, and prevention for a safe and just community in Shawnee County. I'm joined here with several members of the task force, and I ask at this time if those members who are in attendance would raise their hand to be acknowledged so that you all can. Yay. Yes, we'd actually love for you to be part of the task force. So. Okay, so the Mayor's Task Force Against Domestic Violence is comprised of a team of professionals from various sectors of our community who are dedicated to the elimination of domestic violence in Shawnee County. Statistically speaking, on a national level, when we talk about domestic violence, particularly interpersonal relationship violence, that's going to impact 1 in 3 women, 1 in 4 men, and 1 out of every 2 gender non-binary or trans-identified individual. And that is just referring to intimate partner violence. That is not counting the number of people who grow up in violent homes or experience violence at the hands of someone who is not their intimate partner. This statistical report placed in front of you captures data from the Shawnee County District Attorney's Office, the City of Topeka's Municipal Court, local law enforcement agencies, the Shawnee County Health Department, Kansas Legal Services, Disability Rights Center of Kansas, Battering Intervention Program, Stormont Vale Health, and victim services providers during the 2024 calendar year. As you can tell, we have a number of folks who are representing the task force in terms of who we work with and who regularly attends. I do want to acknowledge Blue Cross and Blue Shield of Kansas as they facilitate our corporate engagement subcommittee. Essentially, what that means is that they are working to establish procedures and protocols within a lot of different corporate entities throughout the county on how to navigate domestic violence, both when someone is an employee who's experiencing it and when someone is an employee who is offending or causing the harm. So the statistics captured on these next two slides demonstrate just how prevalent domestic violence is within Shawnee County. It is clear from this data that domestic violence continues to be a significant concern within our county. We know that relationship violence doesn't just impact the abuser and their direct victim, but also affects children, friends, other family members, loved ones, bystanders, neighbors, schools, employers, faith communities, just to name a few. So when we look at some of these numbers, and you'll see even more that are in the report, you can see the breakdown of how many domestic violence calls are made to local law enforcement and how many arrests were made in the calendar year. So a little over 2,100 domestic violence calls, or calls, 911 calls that were flagged as domestic violence occurred, with about 1,400 arrests made. 993 victims and survivors scored high on the lethality assessment, just to give you some kind of a breakdown of what that means. So lethality assessments are implemented by our local law enforcement agencies when there is a domestic violence tagged incident. So when it is safe to do so, they will ask a series of questions of the victim survivor, and depending on how they score can indicate how likelihood a homicide is to take place. Okay, so when I score high on a lethality assessment, that is an indicator that statistically speaking, I am likely to be murdered by this person. These numbers, 993, only represent the city of Topeka, because we are only pulling data from the Topeka Police Department in terms of the lethality assessment numbers. So when we think about the entire county, that number is actually higher, okay? Also within the city of Topeka, we have 261 repeat domestic violence offenders, folks that law enforcement is going to and identifying as perpetrators multiple times. In some cases, we have folks who are offending half of the year. So once a month for 6 months, whatever that might look like, law enforcement is coming out to their homes. So again, these are things that we're keeping an eye on. We also had approximately 1,100 domestic violence cases that were prosecuted both by the City of Topeka's municipal court as well as the Shawnee County District Attorney's Office. A couple years ago, through the city, they implemented a process to be able to prosecute domestic violence crimes again. And so now we see both entities, both the municipal court and the District Attorney's Office doing the prosecution. So that's been really interesting. Furthermore, we have the number of Shawnee County residents who are represented by Kansas Legal Services or the Disability Rights Center of Kansas. Those individuals are folks who are typically receiving legal assistance through the protection from abuse orders. So they have applied or petitioned to get a protection from abuse or protection from stalking order. We had 156 battering intervention assessments that were completed specifically for Shawnee County residents. What I will say about battering intervention is that is best practice in terms of reducing the recidivism rate when it comes to reoffense. So we're really advocating to judges and other local leaders the importance of ordering battering intervention programs as opposed to ordering anger management classes, for example, because these we know are significantly more effective and are best practices. And those entities that provide those services are the Family Peace Initiative and Washtage Peacemakers Men's Project. Both of those agencies are here in Shawnee County, and they are certified by the Attorney General's office to provide those services. At Stormont Vale, we had 369 patients report when they were doing an assessment through the emergency department that they did not feel safe in their relationships. So again, even more ways of assessing the likelihood that folks are experiencing violence in their relationships. And then we had 854 victims and survivors of domestic violence living in Shawnee County receiving advocacy services. So just kind of giving you a general overview of what we're seeing here. So some of the things, this is the fourth year. I don't know if I mentioned that. This is the fourth year that we have pulled these numbers. So next year, we're going to have an even more robust program or data analysis that will show you what it looks like or what it has looked like throughout the course of these 5 years that we've collected this information. But what we continue to see in terms of safety barriers and concerns is the lack of affordable housing within Shawnee County, limited public transportation within Shawnee County, really contributing to the danger factors as it relates to survivors needing to access safety. And so those are things that create problems in terms of individuals feeling like they can safely leave a relationship because many times there are financial barriers that prevent them from doing so. I'm going to have you turn to page 5, and you can see just a little bit of what we have learned in terms of zip codes. In one of our presentations at the City Council, they had asked for us to present kind of an understanding geographically of where we're seeing these calls, specifically law enforcement calls, because that's where we're collecting the zip code data. And so you can see on page 4 the breakdown within TPD, the Topeka Police Department, and where they're responding, but you can see where the Shawnee County Sheriffs are responding in relation to zip codes. You can kind of see at least this snapshot of this year where they're seeing more calls to respond to domestic violence than other areas. That isn't to say that that's where domestic violence is occurring most often. That's just capturing who they're responding to, who is reporting domestic violence to law enforcement. And then finally, as we look at a comparison, again, just kind of capturing what's been happening over these first 4 years, what I would say is most significant right now is just noticing the increase in law enforcement calls. So if you look at page 6, you can see that every year we have steadily increased the number of calls, 911 calls related to domestic violence, the number of arrests that we've seen within Shawnee County. And so, again, just recognizing that it is continuously increasing in terms of utilizing services and resources that local law enforcement and prosecutor's office have to address these issues. Again, that doesn't mean that domestic violence rates are going up. It just means that more people are reporting to 911. So with that, I'm happy to take any questions. We're always excited to have more people on our task force. We think it's really important to have as many folks from the county represented as we can. And so, of course, folks are welcome to email me if they're interested in joining or just wanting to be on the listserv so that they can get regular updates about what we're doing. But I'm happy to take any questions that you may have at this time.
Any questions?
No.
No. Thank you for the good work.
Thank you. Well, thank you for the opportunity to be here. We really appreciate you all.
All right, appreciate you.
Thank you.
Okay. I believe that brings us to the end of our presentation portion of the meeting. And so our next item of business is public comment. Is there anyone? I didn't have anybody signed up, so is there anyone wishing to make public comment today? Seeing none, we'll move on to administrative communications. Any administrative communications today? Commissioner Rippon?
I don't think I have anything to add.
Commissioner Cook?
No, just I see our elections commissioner sitting at the back. Voting is underway, and if you want to go vote early, I think they've got their hours posted so that it's accessible to the public.
That's right. So I don't have anything else to add. So our next item is executive session, and we do have a need for executive session today. So I will make a motion that we go into executive session for a period not to exceed 15 minutes for matters that would be deemed privileged in the attorney-client relationship. Specifically, we're going to be speaking about Maynard Conference Center and real estate proposals, so contract negotiations, that type of thing. So we'll begin that at 10:15. Is there a second?
Second.
Motion's been made by Commissioner Mays, second by Commissioner Cook. Those in favor say aye. Opposed? Motion passes 3-0. We'll head to executive session. We'll be back hopefully at 10:30. All right, we're back from executive session. No action was taken, so we're adjourned.